All right, let's get right into it. Today, we're tackling something that, well, it just doesn't add up. We're told all the time that modern therapy is this incredibly scientific, effective thing. But if that's true, why are we in the middle of a massive and worsening mental health crisis?
And this really is the heart of the matter. On the one hand, you have treatments that are hailed as the gold standard. But on the other hand, you have a crisis that just keeps getting deeper and deeper. We're going to dig into why these two things don't seem to line up at all.
So just how big is this problem? Well, in the United States, more than 1 in every 5 adults is dealing with a mental illness. Think about that for a second. That's over 45 million people. These numbers are they're stark. And they paint a picture of a really widespread struggle.
And look, the stakes here are incredibly high. This isn't just about people feeling down. We're talking about a public health emergency that's literally shortening lives. It's contributing to a drop in life expectancy that we haven't seen in 100 years, at a time when most of the developed world is seeing the exact opposite happen.
Okay, so this is where it gets really weird. As the crisis gets worse, what do? We double down on the so-called evidence-based solutions. Things like cognitive behavioral therapy, or CBT, and antidepressants. Their use has absolutely skyrocketed. I mean, half of all therapists say they use CBT, and antidepressant use is up by a whopping 64%.
So what is going on here? If the cure is being handed out more than ever, why aren't things getting better? It's a question that forces us to take a much harder look at the treatments we've put all our faith in. Is this gold standard really as golden as we think it is?
All right, so let's zoom in on the most popular therapy out there, CBT. It's promoted as the scientific benchmark for mental health care, but when you look closer, you start to see some pretty serious cracks in the foundation. I mean, listen to this quote from psychologist Jonathan Shedler. He's saying that for a lot of people dealing with depression, these quick, structured CBT treatments just don't work. They don't provide any real, lasting relief. That's a pretty powerful pushback against the common narrative.
And that gets to a huge issue here: relapse. For many, the effects of CBT just don't stick. The majority of patients find themselves right back where they started within a year, looking for help with the exact same problems. It really begs the question, right? Is it just managing symptoms, or is it actually fixing the underlying issue?
And check this out. It's not just a feeling. We can actually see this decline in the data. Recent large-scale analyses have found that CBT is now about half as effective as those first studies claimed it was. Its measured impact has been consistently dropping year after year since it came on the scene. So why? What's behind this drop? Well, a huge factor is something called publication bias. It's this tendency where studies that show positive results get published, and the ones that show negative or neutral results just get shelved. It's estimated that this has inflated how good we think CBT is by a staggering 75%. That means the picture we've been shown is seriously distorted. Okay, so if the so-called quick fix isn't really fixing things, then what's the alternative? Well, this brings us to another way of thinking about therapy, what are often called depth therapies. These are approaches that focus more on insight, on the relationship, and on creating change that actually lasts.
Now, first things first, we've got to bust a major myth. You often hear that therapies like psychodynamic therapy are old-fashioned or unscientific. That's just not true. There is a ton of solid, rigorous evidence showing that these approaches are effective.
And this is maybe the most mind-blowing part. It completely flips the script on what effective even means. With CBT, we saw that the benefits can fade away. But with depth therapy, studies show the positive effects can actually grow over time. Patients keep getting better, months, even years after they've stopped seeing their therapist. It's like the therapy keeps working, long after you've left the office. So, to really put this to the test, a huge analysis led by Christiane Steinert put these different treatments head-to-head. And this is a huge deal. Her team made sure to control for researcher bias, which is a massive problem in this field. And what did they find? For all the common issues, depression, anxiety, you name it, psychodynamic therapy was every bit as effective as CBT and medication in the short term. And when Dr. Steiner presented these findings, her conclusion was blunt. She said, the horse race is over. Her point was simple. Stop arguing about which is better. The evidence is clear. Depth therapies are just as effective, and as we just saw, they might even provide benefits that are much more lasting.
Okay, the data is powerful, but what does this actually feel like for a person? Let's move away from the charts for a second and look at two stories that really show the difference between just managing symptoms and getting to a place of deep personal understanding.
So let's talk about Katie. For years, she was stuck in this idea that she had a chemical imbalance. She went to therapy, she learned all the coping skills, but she was so frustrated because she never actually used them. Through deaf therapy, she had a breakthrough. She started to see her feelings not as symptoms of a broken brain, but as totally valid reactions to her life. For the first time, she really got what was holding her back. And today, she's been off all her medication for over a year.
And then you've got Mike. By the time he was in his early 30s, he'd already seen more than 20 therapists. His life was just this frustrating hamster wheel. Get a diagnosis, find a specialist for that diagnosis, do a few months of therapy, feel a little better, then relapse and start the whole cycle over again, never ever understanding why. The game changer for Mike wasn't some new coping skill. It was a moment of insight. He realized that the way he was approaching therapy, treating himself like a checklist of diagnoses, was the exact same pattern that defined his relationships. He was just reenacting this core feeling of being seen as a problem to be fixed, and that realization was what finally allowed him to step off the hamster wheel for good.
So you've got to be asking, if this kind of deep change is possible, why isn't it the default? Why is everyone still getting the quick fix? Well, it turns out it has a lot to do with how the very idea of evidence-based treatment has been twisted over time.
See, the whole idea of evidence-based practice started out as this really balanced concept. Think of it like a three-legged stool. One leg was the best scientific research available. Another was the therapist's own clinical wisdom and expertise. And the third leg, a really important one, was the patient's own values and what they wanted out of therapy. But that's not what evidence-based means today. Not even close. Two of those legs have basically been kicked out from under the stool. The therapist's judgment and the patient's preferences, they've been sidelined. Evidence has been shrunk to mean just one kind of research, the kind that favors short, manualized, low-cost treatments that, surprise, surprise, insurance and drug companies love. And you don't have to look far to see what happens when you bet the farm on these quick fixes. Sweden poured almost $7 billion into a nationwide push for CBT and medication, and it had no meaningful effect on outcomes. Scotland found the benefits of their big CBT program just washed away over time. And in England, a huge initiative to train more CBT therapists saw a 63% dropout rate from patients. This isn't just a fluke, it's a clear pattern.
So it all comes back to this. We're not just a collection of symptoms in a diagnostic manual. We're complex people with rich inner lives. And you have to wonder, is our healthcare system's obsession with a quick, cheap fix actually stopping us from getting the kind of deep, meaningful, and lasting change we all want, and frankly, that we all deserve? It's definitely something to think about.